Hi there, I'm Dr. Matthew Goetz. I'm a breast cancer medical oncologist at the Mayo Clinic. I am a member of the Alliance Clinical Trials Cooperative Group, and on behalf of the Alliance as well as the National Cancer Institute, I'm pleased to present the final results of the Alliance A011203 study, in which we studied the drug Endoxifen in a randomized fashion and compared it to the drug Tamoxifen. The background, of course, is that Endoxifen is an active metabolite of Tamoxifen, and there are studies showing that the levels of Endoxifen are critical in patients treated with Tamoxifen. And so, in collaboration with the National Cancer Institute, we developed Endoxifen and tested it directly against the drug Tamoxifen in the metastatic setting. Here's the design. We took patients who were postmenopausal, who had ER-positive breast cancer, and they were randomized in a one-to-one fashion to either Endoxifen versus Tamoxifen. Patients were allowed to cross over to Endoxifen at the time they were progressed on Tamoxifen. And you can see that the statistics here show that we had, using a one-sided alpha of 0.10, with a generalized log rank test, we would have a 90% chance of detecting an increase in the median PFS from 3 months with Tamoxifen up to 6 months with Endoxifen. Also, using the Garden assay, we also did a testing with ctDNA to look at alterations in ESR1 as well as PIK3CA, PTEN-AKT. Here's our consort diagram. One of the unique things about this study was we required a biopsy, and patients were allowed to enroll if they had ER-positive, HER2-negative breast cancer. You can see that there were some patients that actually did not meet this requirement. Perhaps they had HER2-positive disease or ER-negative disease. 81 patients were randomized, and ultimately we had 40 evaluable in the Endoxifen arm and 36 in the Tamoxifen. Here's the patient characteristics. Important to note that these patients were fairly heavily pretreated. Over a third of patients had 3 or more lines of endocrine therapy, and about half of the patients had prior CDK4/6 inhibitors. Here's the primary result using the interval-censored approach. Tamoxifen improved median PFS from 1.4 months up to 4.3 months. With a generalized long-range test for interval-censored data of 0.12, this did not quite meet statistical significance, but a clear trend. And using the Kaplan-Meier approach, we do see that, again, a clear separation of the curves comparing Endoxifen versus Tamoxifen, and an improvement in median PFS 1.7 to 4.3 months. This is an analysis that we did, importantly, looking at patients who had no prior CDK4/6 inhibitors. And we wanted to do this to really analyze what is the activity of this drug in a more endocrine-sensitive population. We know that endocrine sensitivity is lost following progression on a CDK4/6 inhibitor. And here you can see in this group of patients, which was more than half of patients, that median PFS was improved with Tamoxifen from 2.1 up to 8.3 months. That was highly statistically significant, both by the interval-censored approach as well as the Kaplan-Meier approach. We didn't really see any major unexpected toxicities. These drugs are extremely well tolerated. Now, if we look at the crossover, we can see that in patients that we allowed patients who were on Tamoxifen to cross over. You can see that there was a group of patients here in red that had rapid progression on Tamoxifen. These had patients essentially were progressing at their first scan. And you can see there was a substantial number of these patients who actually went on to have substantial benefit on Endoxifen. This is calculated here, looking at the median number of cycles on Endoxifen after they progressed. It was about 5, clinical benefit rate of about 30%, with a median PFS of 3.6 months. And you can see this ranged from some patients with rapid progression. We had some patients who were on Endoxifen after progression on Tamoxifen up to 15 months. Finally, we looked at alterations in ESR1, PIK3CA, PTEN, and AKT, and essentially found that there was really no differences in outcomes in those with and without these alterations. And so our take-home point is that this study showed that Endoxifen improved median PFS from about 1.4 months up to 4.3 months. It didn't quite meet statistical significance, but the overall data really are quite comparable to what we're seeing with the other SERDs that are in development. And this drug is now moving into the neoadjuvant setting and is actively being tested in the Evangeline study.